WBUR Podcasts, Boston.
I'm Carrie Young, in for Daryl C. Murphy, and you're listening to The Common. Gabrielle Emanuel, senior health and science reporter with the WBUR newsroom. How's it going?
It's going well. It's good to be here.
Okay, Gabriella, I'm going to jump right into it with you today because you've been covering a really important story about a policy that just ended at Boston Medical Center that provided shelter to many unhoused and migrant families. Tell us about this policy and what just happened.
Absolutely. So in Massachusetts, we have a state-run family shelter system. But it can take a while, sometimes days or many days, to get into the family shelter system. So while these families are navigating the application process, they often have nowhere to stay overnight for those first few days. That's when the state field offices close, when the new welcome center closes at night. Where do these families go? And often the answer is a hospital emergency room because it's a safe place that's open 24 hours a day. This has been going on for years and years and years. But in recent years, particularly the past year, Boston Medical Center, Boston Children's Hospital, these places have seen a big uptick in the number of families seeking shelter, having no health problems and just going to the emergency room for shelter. What they get there is social work services, they get food. Sometimes there are dozens of families each night in the emergency room or in the hospital lobby. This can take a substantial amount of hospital resources. So they've been asking the state for better solutions. That has not yet come. So earlier this month, Boston Medical Center decided they're changing their policy and they're no longer going to let these families sleep on the floor in the lobby. There was an internal memo that was sent out to staff that WBUR obtained, sent out last week, where the president and CEO cited safety concerns, saying this is disrupting normal hospital operations and it's impacting the ability of the hospital to respond to emergencies. So it cannot continue.
And about how many people are we talking about here? I know you said dozens, but what was that top number that they reached recently?
Exactly. So part of what drove them to make this change is that they reached a new high. So one night earlier this month, 131 individuals slept in the BMC lobby, in the Menino lobby. They had, cribs and cots provided by the hospital, and that was a new high for them.
Wow, that's a really big number of people to think about sleeping in a lobby together, especially a lobby that's not really meant for housing or emergency housing. And we mentioned earlier that this is impacting mostly migrant families. Whereabouts are they coming from to get here?
Yeah, so the ones showing up in Boston, the vast majority are coming from Haiti originally, but many have been on the road sometimes for months or even years, coming through, say, Brazil or Chile, all the way up to the U.S., and then often going to other states before arriving here in Massachusetts.
What kind of factors are all coming together to lead us to this spot?
Yeah, so I think over the past year, as the numbers have been increasing and as the hospitals have really been this kind of critical piece of the safety net that they're not designed or paid to be, they've been pleading with the state and cities also to figure out another solution. So their new policy is to offer free transportation to wherever the family wants to go, whether that's where they stayed the previous night or to a relative, a church, another secure facility. But many of these Haitian families in particular have no connections here. And so many of them have been sent to Logan Airport as a place that is open, has restrooms, has food for purchase, has security around, just to wait there, not to be sent home or something like that, but to wait there until state field offices open.
I mean, this seems like a really big policy shift. And also the idea of going to Logan as opposed to a hospital lobby. Totally different environments in my mind. What do you know about the way advocates are responding to this decision?
Yeah, so many advocates have said that the Logan Airport solution is really not a solution. One called it kind of the worst case scenario to me. They can say that Logan Airport can be particularly traumatic for these individuals and these families who've already gone through so much, particularly because there are immigration officials there and they've kind of, people who have been on the road and traveling for so long that this is not a suitable place. Also, hospitals have trained social workers and people who are, know how to deal with a family that might be in crisis. There aren't really social workers walking around Logan Airport. So while the hospital is not seen as an ideal situation, Logan is seen by many of the advocates I've spoken to as even worse.
And have you heard from any of the families impacted by this? People who are now searching for shelter since BMC is no longer an option?
Yeah, so some of these families that were sent from BMC to Logan were then taken by state troopers to La Colaborativa, which is a social services agency in Chelsea. It has a long history of taking care of kind of newly arrived families. And they've been kind of providing for their needs. I have not personally been able to meet with them yet, but Boston City Councilor Ruthie Louis-Jean did meet with several of these families. She was able to speak with them, hear about their journey and where they're at now. So here's what she told me.
So I think folks are grateful to be getting some level of assistance, to say nothing of the trauma that they're living with every day. But they're asking questions, they're trying to figure out how to navigate, how to understand our systems.
And I should say, BMC says that the number of people that they've put in Ubers to the airport is a very small fraction of all the people they've cared for and helped during this, years-long crisis.
We're going to take a quick break, but we'll be right back.
Did you kill Marlene Johnson?
I think you're one of the first people to have actually asked.
From WBUR and ZSP Media, this is Beyond All Repair, a new podcast about an unsolved murder that will leave you questioning everything.
Somebody should be in jail for murdering my sister.
A woman who's never been believed.
As long as they think I have done this, then they're not looking for who actually did this.
And that's what makes it a cold case.
No, it's a botched case.
And a search for the truth, once and for all.
Wow, it just gets more interesting.
Beyond All Repair. Listen and follow wherever you get your podcasts.
Be careful. You're digging in a place that's been very peaceful for a while.
Do it anyway. Dig.
And we're back. When I read this story, what really stood out to me was just how fragmented the support system is for folks in need of shelter here in Massachusetts, especially when it comes to people who are maybe new to the area or just lack their own networks, whether it's friends or family. So when it comes down to it, who is technically responsible for finding shelter for these people? And how did we get into this situation?
Yeah, this is a really multi-layered, kind of messy problem, but there are a couple things going on here. One is there is this homelessness crisis where the numbers have been increasing lately, and that's a combination of very high housing prices here in Massachusetts, the ending of eviction protections, and this kind of increase in newly arrived families. I'm hearing that some organizations, just one organization is seeing, 40 new families a day. So there are a lot of people coming in. There are also multiple levels of government involved. So the federal government has been blamed by many for not doing work authorization for many of the newly arrived families, such that it's very hard to provide for yourself and for your family through legal means. And then in Massachusetts, it's one of the only states, it is the only state that's a right to shelter state. There are some cities like New York City, D.C. that has a right to shelter, but we're the only state with a right to shelter, which means that we don't have nonprofits running our family shelter system. We have our state. So it costs hundreds of millions of dollars. Families tend to stay in the program on average for 14 months. So this is a big use of state resources, and they're kind of the one who are having to figure out what to do with this complex problem.
Well, and what do we know about what the state is working on right now? Like, has Governor Healy said anything about this? Have we heard anything new about a broader plan to address this issue?
Yes. So what we do know is that they are working around the clock. They're meeting even on weekends, lots of different teams coming together to meet. That said, they have not given many specifics to the public about what the overarching strategy is and what this kind of will look like going forward. We do know that they've just started trying a new model called the Family Welcome Center. There's one open in Alston to try and get families connected with basic needs, think like diapers and food, and also connected to resources. Unlike kind of the shelter system where you have to be eligible, this is taking everyone, particularly newly arrived families. But they're really swamped, and there's only one of those centers right now. They say they're opening more. I will say they're trying also host family program where they're asking kind of people to open up their homes for at least a few days, especially on weekends, to give these newly arrived families a place to go, a room to stay in.
Can you dig into that a little bit more? Like, what is the host family program and how does it work, really?
Sure. So the idea of a host family, are people who take in somebody and give them a place to stay, is not a new idea. It's been used in refugee resettlement for folks who come through the State Department for a long time. It's used in other countries. It's very common in Canada that a group of families will team up and do this. But it's the first time from advocates, they say that this has been applied kind of more broadly to homeless families. And the way this is working right now it's a very small program, and it's run through the Family Welcome Center, which the state has a contract with the Brazilian Workers Center to run the Family Welcome Center. And right now they're going through their networks of known individuals who might have space, but they're in charge of recruiting, vetting, onboarding families, and it might be expanded to include kind of anyone who has a room that's willing to do this. Take someone in for, they're saying right now, a few days, especially over the weekend. And if they do expand, they're saying there will be some sort of background check involved. Although the specifics of the vetting, whether there's a site visit or not, that has not been told to me. And I will say, when I talk to advocates, they say a big question is how to vet these families, how to make sure they're safe. But in general, they say they understand the need, and that while they should continue to pressure the state to do more, they have the support in setting up this new host family model. Here is Gerald Gabot, who is the executive director of Immigrant Family Services Institute, or IFSI.
While the state is trying to figure out exactly what to do and to open up more shelters, I think we as citizens, as members of our community, we also need to play our role.
Gabot says that she actually thinks citizens could be doing a whole lot more than we're doing right now to help these newly arrived families.
Wow, so many twists and turns in this situation. I know you've been following this for a little while now. As a reporter, what are you watching for going forward now?
Yeah, so I would say two different things. There's a really big question about what the state is going to do for that overnight period when they were going to Boston Medical Center, when their offices, the state offices, close. Where should these families go? And there's not a clear answer right now. So a lot of homeless advocates have been calling on the state to open an intake center that is 24 hours. The other thing is there have been some groups that have said the Healy administration should declare a state of emergency to try and open up resources, reduce some of the regulations to address this. So far, the Healy administration has not done that. Other states have to deal with newly arrived families there, but I'll be watching to see if that happens.
All right, Gabriella, we'll leave it there. Thank you so much for talking with us today.
Thank you.
That was Gabrielle Emanuel, the health and science reporter in the WBUR newsroom. And that's our show for today. Thank you so much for listening to The Common. Do you have thoughts on how the state can best support families in need of shelter? Send us a message on Instagram at WBUR The Common, or shoot us an email at thecommon@wbur.org. For now, I'm Carrie Young, and I'll talk to you tomorrow.